representing the Federation of Partisan Welfare Agencies, a member of the People's Budget Coalition for Public Health. We are hosting the press conference today in response to the Mayor's executive budget. Today I'm joined by a number of community-based organizations and unions, and I'd like to take a moment to acknowledge their presence here. So we have the New York State Nurse Association, we have District Council 37, we have Local 436, we have the New York Immigration Coalition, the Commission on Public Health Systems, and Greater Brooklyn Health Coalition, Local 1549, and then we also have the Coalition for Asian American Children and Families, and
Center for Independence and the Disabled.
Center for the Independence and Disabled, and Choices in Childbirth. Who else? Japanese American Association, and Doctors Council. Very important. Dr. Hurley's gonna speak. And so the first speaker for our press conference is Anthony Feliciano, and he's the director of Commission on Public Health Systems.
So, the executive budget released by the mayor takes the steps to the right direction. We applaud certain items that have been put in the executive budget. We see that there is an increase in HAC subsidy, Health and Hospitals Corporation, which is duly needed as our vital safety net provider in New York City. We also have seen that the health department, although we don't have all the details, is looking to create a center for health equity to address health disparities in New York City. How that will look like is going to be very important. We want to be involved in that. We want to make sure that communities and groups are involved in how that's going to look like. The other areas that we care about is that we came together because we want to address health disparities. We want to address what we call social determinants of health. What we say is where you live, where you play, where you work, how you age is all important in New York City. And so we want to ensure that those things are going to be addressed. And so we came together because we also applaud the fact that there is going to be an expansion of pre-K. There's going to be issues around expansion of housing, all things that we call social determinants of health. But as People's Budget Coalition, we want to address those and continue making sure that healthcare system is rooted in our neighborhoods. Even though the mayor's priorities reflect some of our priorities, our community health needs that we care about, we see opportunity to do even better. We want to emphasize that the successful and comprehensive healthcare system is a result of a prescription that includes access, quality services, fairness, equity, and community. If one element is missing, the prescription does not work. We can't allow the budget to overlook the fact that too many are consistently left out of planning or left with substandard care or no care at all. And that often the factor that is determining who's left behind is income, race, immigration status, disability status, gender, language, and sexual orientation. We know that the mayor and the city council understand this, and we urge them to support some of our health priorities that we will be discussing today. We urge them that as we move forward in transforming this healthcare system, as we have these dollars from the Medicaid waiver coming down, that communities and our healthcare workforce must be involved in those decisions that are made around the resources, allocation, distribution, and allocation of services, particularly when it addresses low-income communities, immigrant communities of color, and all the other communities that we care about that deserve a right to health care, but also deserve to be part of that planning process. Thank you.
Speaking of preserving and expanding the public health system, the next speaker, Dr. Matthew Hurley from the Doctor Council, will talk more about the importance of allocating more unrestricted
Vice President of Doctors Council at SEIU. We represent the doctors who work in the HAC public health care system, the safety net hospitals that so many of New York's most vulnerable populations depend on every day. Doctors Council is a union for doctors and a voice for patients. We take serious our role as patient advocates. That is why we are here today, to ensure more timely access, quality and affordable health care, and improve the way community health care is delivered in New York City. Our public hospitals should never be a place of last resort. Thanks in large part to the inclusive approach of Mayor de Blasio toward our safety net hospitals and the diligent work of the healthcare advocates across the city, New York has the opportunity with this year's budget to address healthcare disparities that long plagued struggling New Yorkers and focus on meaningful quality improvement measures that matter to our patients and communities. We want to ensure that as much funding as possibly goes to the safety net facilities to protect and preserve timely access to quality and affordable care in our communities. We are proud to stand with our partners in the People's Budget Coalition today and look forward to working with healthcare professionals, community members, patients, and Mayor de Blasio to ensure New York City is the best provider of care to our loved ones. Thank you.
And now we are going to invite President Judith Arroyo of Local 436 of District 37 to talk about some concerns related to the immunization clinic.
I'm Judith Arroyo. I'm the president of Local 436. We're part of District Council 37. This local represents over 1,000 public health nurses and public health epidemiologists who work for the city of New York. And our model is that we keep New York City healthy. And while we applaud the fact that a lot more money is now being put into the budget to address the public health safety net, it is a bitter disappointment that certain things are being kept from the previous administration. It is a bitter disappointment that this administration is still thinking of closing, in fact, are going to close the immunizations in Tremont and in Corona, Queens come July 1st. If you're going to create centers of healthcare excellence, then you should not be closing clinics in areas where we have our most vulnerable population. Poor, folks who are immigrants, until they can get access to Child Health Plus or any of the other healthcare access for their children, these free clinics that the Department of Health runs are the only place where they can go get quality health care in their neighborhoods. This will only leave one clinic, one immunization clinic in all of New York City open, the one in Brooklyn. We have heard press conferences from the Department of Health and media releases about measles outbreaks, about the fact that polio has come back. There's a resurgence of tuberculosis. The function of a Department of Health is to identify, control, isolate, and if necessary, eradicate these diseases. The Department of Health, in closing the immunization clinics and in cutting back some of the other public health programs, are actually abandoning what should be their main function in protecting the citizens of this New York. This local, along with the coalition, is going to fight that, and we're reaching out to Mayor de Blasio. You promised us one city, and you promised us that no one would be left behind or forgotten. We want you to fulfill those promises. Thank you.
Speaking of the need of the most vulnerable population in New York when it comes to access of public health services, I want to introduce our next speaker, Jackie Bimo from the New York Immigration Coalition. Thank you.
Good morning, everyone. Hi. So, my name is Jackie Bimo. I'm here on behalf of the New York Immigration Coalition. We're a coalition of nearly 150 organizations that work with immigrants across New York State. I just want to start by saying that this is such an exciting moment. Are we excited? Yes! It's an exciting moment nationally, you know, with health reform leading to nearly 1 million New Yorkers receiving access to health insurance coverage in the last year. And it's an exciting moment in New York City with a new mayoral administration and a new city council. However, as people have already mentioned, many challenges remain. We know that federal health reform left out immigrant populations, right? Left them out. In addition, here in the city, our hospitals are facing closures, and our public hospital system is grappling with serious financial issues. So in recent years, as we know, many of the major decisions about public health and our public health system here in New York have been made without community input, right? They've been made in a top-down way without consulting the communities that are the most vulnerable and that are the most affected. We know here at the People's Budget Coalition that it is immigrant communities, communities of color, and vulnerable populations that know best what the big health challenges are in their communities. So we're here today to call for a new community health planning process that would engage communities on the ground, that would include the voices of those that are most vulnerable in addressing the needs of public health in New York. We're so lucky to have a strong public health system here in New York. At HHC, the Health and Hospitals Corporation, HHC's doors are open to all New Yorkers, regardless of immigration status or ability to pay. We're here to say that we, the community, want to be part of the process to ensure that those doors stay open. Thank you.
Speaking of the implementation of the Affordable Care Act, as many of you know that New York State received some federal funding to develop these navigator programs, and the next speaker, Suki Terada Ports, representing the Japanese American Association, is going to give you an example of how important it is to include all communities in the public health planning process.
Good morning. This is an example of how important it is that we work in a collaborative way and provide culturally and language appropriate outreach services that connect people with care, which is critical because I'm going to share with you an example of what could have been a terrible tragedy for the Japanese community. The Japanese American Association has been here for over 106 years, and we provide a variety of services for people from little toddlers to our oldest 102-year-old gentleman. But this is an example of what happened when we found out that there was no navigator in the entire state of New York who spoke Japanese. This historic significance is that the Korean Community Services stepped up to the plate and said, we will help you, even though the two countries have been for many years not the greatest of cooperating friends. But people of Japanese ancestry were able to get help from the Korean American Community Services Organization, which provided a navigator who spoke in English. We then had a translator from the Japanese American Social Services who spoke in Japanese to the people who preferred to speak in Japanese. Then they in turn asked their questions and comments in Japanese. Then it was translated into English so that the Korean navigator could then give the answer that would be appropriate for that situation. In the process, we found out that New Jersey was also without a Japanese-speaking navigator. And so the navigator from the Korean American Services, Community Services, went to New Jersey, learned what their regulations were, and we held a meeting in New Jersey with people in New Jersey so that they could become registered also and enrolled in ACA. So, you know, it couldn't be more of a tragedy if there hadn't been the cooperation of one group helping the other group. Thank you.
Thank you, Suki. Our next speaker, Stephen Beasley, between CBO and government agencies, so that examples like what Suki just shared won't happen, and then we have a better approach to engage the community to take advantage of the public health programs and services that we offer.
So I'm Stefan from the Greater Brooklyn Health Coalition and CAMBA. For about 11 years, I have been serving in federal, state, city, and privately funded health and human services initiatives. And it's become glaringly obvious that there needs to be a robust and ongoing local control of and also influence in public health issues and the allocation of healthcare resources. Cuts to our vital New York City services have been ongoing. We've seen them in the media. We see them physically in our communities, and it hasn't been taken into full account the socioeconomic and also the societal impact that will grow exponentially in these areas that are already suffering. A report released in April of 2012 by the Institute of Medicine stated that the U.S. has spent extravagantly on clinical care, and that's very, very important. However, we spend meagerly on a national and local level on preventative services and on other population-based services that can be just as impactful, if not even more impactful sometimes, than medical services. So, our recommendations to the City Council and to the new administration highlights a community health planning approach with an emphasis on meaningful and ongoing partnership between government and hospitals and medical providers and community-based organizations and advocates, which has already started to happen. I really do want to acknowledge that our City Department of Health, the District Public Health Offices, the City Council, and members of the administration have already started dialogue. We need focused, meaningful, action-oriented, ongoing partnership so that we can empower and serve our low-income residents, our immigrant populations, our communities of color, our women and children, as well as folks that I saw on the way here, our fellow New Yorkers suffering with disabilities, and well, thriving with disabilities, I should say, and also those with chronic illnesses such as diabetes, kidney disease, HIV and AIDS, asthma, and other illnesses, and really who represent the great strength of this city as they persevere through their daily struggles. So, in the end, I just say that we hope that our administration supports us financially and also helps us to foster exponential growth and impact in our services so that we can together sort of roll up our sleeves and do the work that needs to be done to positively impact our health outcomes. Thanks.
We also have Ralph Palladino from Local 1549, and he is going to also share the perspective of how important it is to preserve the HHC infrastructure, and also some comments on the Medicaid program.
Thank you. Local 1549, PC37, represents about 4,500 employees in the public health system, HHC, including the Metro Plus HMO, which is a HHC HMO that is public and recognized as the best HMO, #1 HMO in the state. I and many of my members get services out of HHC. My life was saved. I had skin cancer and asthma, and I almost died from an asthma attack in 1986. Went into the Bellevue emergency room. Today I'm followed up by the clinic, and in 2 weeks I'm going to cease having to use asthma medication, which I was told that would never happen in my life. So I'm appreciative of the public health system. And we were here months ago, before the election, talking about democracy and the fact that there has to be decision making from the grassroots in terms of health care. That was not really done with the waiver in Washington, and it hasn't been done so far with the delivery of health services in the city of New York. The Health and Hospitals Corporation is facing a $430 million cut, not cut, but a deficit this year. It'll be $1.8 billion by 2018. The City Council has put in some money to assist HHC. The money from the administration is $1.7 billion, but that $1.7 billion appears to be the waiver money. We don't know if the city agrees that city money also should go into that. In terms of the waiver money, there's two sets of things going on. You have the private and the public. While the safety net hospitals and community hospitals are important, we want to make sure that the money does not go to entities that have CEOs making millions of dollars, and we want to make sure they really go to the safety net hospitals and HHC. And HHC as a public entity must have equal playing field with those private hospitals. Right now, they don't. Under the agreement so far is that they must submit specific projects while the community-based hospitals can just say we need the money, and that would be sufficient. That's unfair. We were going to have a public option in national health insurance, and we were told that we couldn't do that because it would be unfair to the private insurance companies. There'd be too much competition because we deliver services at 3 to 5% overhead, and the others in the private sector 15 to 20% overhead. So it's cheaper to use public health, and it was defeated. Now, why the switch? HHC should have an equal share and equal playing field with the private hospitals in this situation, and there should be a reform to that particular measure, and I'll just read this short. Funds will be awarded to preserve, sustain, and possibly strengthen or expand services that are critical to the applicant's community that are threatened by financial constraints. These include existing services that are currently provided by the applicant and other provider in the service area that are languishing or potentially being abandoned due to lack of funding. And that includes not just the hospitals like they say they want now, but also the clinics. Ambulatory care must be expanded and throughout the city and in the communities, and they need to have capital funding for it as well, not just hospitals. Thank you.
Speaking of getting more funding to the local community level, the next speaker, Nan Strauss, representing Choices in Childbirth, is going to talk about how the positive impact of having healthy women, healthy future, which is a new initiative that the People's Budget Coalition for Public Health is supporting. Thank you, Nan.
Good morning. I'm here to talk about the dramatic health disparities facing the women and infants in this city. We can't have a healthy city of New York without healthy mothers and healthy babies. And more needs to be done to reach women and infants in at-risk communities. We need this to be a focus of care before women become pregnant, during pregnancy, and after. Over the last 12 years, we've seen with the Infant Mortality Reduction Initiative real successes at getting women into prenatal care and comprehensive services early on. And these comprehensive services, when they're delivered in the community by community-based organizations, have been incredibly effective at improving outcomes and addressing these dramatic disparities. But while much progress has been made there, the improvement in infant health has not translated into an improvement in maternal health. There's been a renewed recognition that there's a dire need for efforts targeted to improving maternal care. The maternal mortality ratio in New York City is among the worst in the United States, and it has been higher than the national average for 40 years. And the disparities that we see here are likewise even more extreme than the national disparities. African American women in this city are 7 times as likely to die from a pregnancy-related death as are white women. We've been developing with other community-based organizations a partnership for a program called the Healthy Women, Healthy Futures program. This new initiative would close the existing gaps in care by taking a comprehensive woman and family-centered approach to addressing women's needs throughout their lifespan. The program's in line with the priorities of the Affordable Care Act, aiming to simultaneously improve outcomes, reduce unnecessary medical costs, and improve patient satisfaction in their experience of care by ensuring that women are as healthy and supported as possible. This program would focus on the gaps that are currently existing. It would provide care in the preconception period, which is before women become pregnant. That's really important to address the rising rates of chronic conditions, particularly in low-income and medically underserved communities. All of those chronic conditions that we see across the board that are on the rise, obesity, diabetes, and hypertension, cause particular risks during pregnancy and birth. And if you wait until a woman becomes pregnant to address these, it's too late to achieve the positive outcomes that we know we can achieve. Once a woman becomes pregnant, the Infant Mortality Reduction Initiative has been successfully providing those services, but then during that critical labor and delivery period, we need to see more attention to women receiving evidence-based care, and one of the ways to achieve that, that's supported by professional associations and by a great deal of evidence, is to provide doulas, labor support for women during that critical labor and birth period, which can bring down medical interventions, reducing costs, but also improving the experience of care and patient satisfaction that we know is so important. The program also provides postpartum support where it's needed, and then an interconception piece provides services for women that would address any complications that arose during that prior pregnancy or birth, but also continue the preventive efforts that we know are critical to keeping women and families in good health for the future. When the Infant Mortality Reduction Initiative was launched, there was a commitment to focus on women's and infants' health throughout the lifespan. And now we have the opportunity to close the existing gaps and move that forward and finally make progress on some of these very intractable disparities. Thank you.
So as you see, our health priorities share three major themes. Community health planning is essential to building a responsive public health system. We need to ensure that our healthcare workforce, our communities, are involved in those decisions that impact their lives. We also want to address health disparities by preserving and expanding community and public health safety net programs that are vital in our communities. And third, we want to build and expand a public health infrastructure that ensures our public health system has the capacity to serve all populations. It's not just about a public hospital system. If this city and this state is talking about transforming the healthcare system, they need to transform it, including us, in that process. We have to ensure that together, healthcare reform does not stop just with the ACA. We have to ensure that the gaps that are coming in healthcare are addressed. We have to ensure that those policymakers and decision makers not only just have her at the table, but have meaningful dialogue with all of us when it comes to access and quality of healthcare, improving and expanding healthcare services in this city. If not, we are going to continue having health disparities, we're going to continue having people fall through the cracks, we will continue having folks in our communities struggling every day to ensure that they can meet their needs. This is not just about closing hospitals, as we've been talking about, but this is about a healthcare system that serves all of us. A healthcare system that works for everyone, every New Yorker. So we have to say that healthcare is a right. Healthcare is a right?
Yes,
it's a right. Healthcare is a right?
Yes,
Healthcare is a right. Thank you.